Shock, confusion, fear, all describe how people feel about cancer. But thanks to advances in cancer research and treatment, we can also feel hope.
Cancer means hope. Cancer means survival. Cancer means that I can beat this thing.
37-year-old Todd Gillum knows about the hope behind cancer. 3.5 years ago, Todd was diagnosed with leukemia, or cancer in his blood cells. He and his wife Evelyn learned that his best chance of survival was to take part in a research study or clinical trial that involves getting blood cells that his body needs from an experimental blood transplant.
You know, it was either live or die. You know, you had to try something.
Todd wanted to stay alive for his children. His faith in God and support from his wife gave him the added strength to say yes to a clinical trial.
For him to go ahead and agree to go ahead and do it, that took a lot. It took a lot of guts, a lot of courage.
But many African Americans do not want to be part of research studies because they don't trust the system. People will always remember the Tuskegee syphilis experiment. Between 1932 and 1972, doctors purposely withheld treatment from 400 African American men infected with syphilis. The men were never told about the experiment. Experts say there are now many rules and regulations to prevent such things from happening again.
People aren't going to hide information and mistreat you because of your race or whatever. I mean, they just can't do that anymore. It's just the system demands that you know what's going to happen and that you agree with it before it happens.
Dorothy Stamps has decided to be part of a research study for breast cancer patients. Before treatment, the medical staff clearly explains the details of the study to Dorothy and her husband. It's good to have family members or friends with you during such discussions because they can help you ask better questions. Here's some questions you might want to ask. Besides being in the research study, what are my other choices for treatment, and what are the risks and benefits of those choices? Is it going to cost me money out of my pocket to get this experimental treatment? What about extra costs? For example, if I have to come to the doctor more often, is there a way to help me pay for my transportation, parking, or babysitting? Who benefits financially from this research study? Is it just the drug companies, or do doctors also make money from this research? Details about the medical aspects of the study are explained in a stack of papers called Informed Consent. Informed consent sounds scary, but it's really an important tool to make sure you understand exactly what your cancer treatment will involve and what the risks and benefits are. Informed consent papers are not like legal contracts. Participating in a research study is totally voluntary, and you can choose to leave anytime you want. There are also rules to make sure you will always be given care that is at least equal to treatments that are currently being given to patients. Experts say the system is now ethical and safe.
The reason to fear it is essentially gone. You can trust the system much more.
Dorothy Stamps decided to be part of a study to test how well a new combination of chemotherapy drugs works.
I don't feel like a guinea pig. I feel like a very special person.
So far, Dorothy has done okay with the chemotherapy. She did lose her hair and gain some weight, but other side effects like an upset stomach and lack of appetite usually disappear a couple of days after her monthly treatments.
I am extremely proud of my wife. Extremely proud. First of all, that she would participate in something that she had no evidence of being a guaranteed success.
While there are no guarantees that experimental treatments will work, patients are guaranteed state-of-the-art care and very close monitoring.
We're watching you like a hawk. We're seeing you all the time. We have a panel of doctors, a panel of nurses, phone numbers that you can call, because we want to make sure that you're safe.
Todd says having trust and feeling comfortable with his doctors has made the difference for him.
These people are really fighting for my life, not trying to get a paycheck, but really caring
In the past, there has not been enough medical research done on women and minorities. That means doctors have had to assume that drugs which have only been tested in white males will also work in other populations. By enrolling in clinical trials, African Americans will help make sure doctors know what treatments work or do not work in the black population.
But you can't get the data unless people come and participate. And it's to our advantage as a people, as an individual, and next generation to participate.
Enrolling in a clinical trial helps two people. You, because I think you're getting state-of-the-art therapy, and your sisters who come after you. Because I can tell them, yes, 50% of the women were African American and they did just fine.
And if more of us will say, yes, we're going to sign up to do this, because we can then tell other people that it's working.
It's important to understand that being part of cancer research does not guarantee that your cancer will always respond to the treatment, but it is your best way to pursue state-of-the-art care. In the case of Todd Gillum, 12 months of very physically demanding treatment has made him cancer-free. Todd will have to be followed by his doctors for a number of years, but Todd feels good about his decision to be part of cancer research.
Every time I come from school, I give him a big hug and kiss. Me too.
I think that if we had to do it all over again, we would. Keeping prayer in mind and knowing that the Lord provides miracles every day.
I'm a trendsetter. You know, I know I'm part of something that's great and will be great. This is a beginning. I'm on the ground floor.
I will